depression is really one of the major symptoms that I think does not get enough attention. It is starting to get more scrutiny now, but it is so easily confused with things like treatment side effects, natural, quote, expected response to having cancer. And really, I think this is some of the reason that we don't identify and treat this very well. So when we think about depression, the major symptoms that we think of often involve mood. So one of the main characteristics is indeed having a depressed mood. However, it does not have to be a depressed mood that is the primary symptom of that depression. People may not perceive or experience a change in their mood, but they may say that they have a very low interest or no interest at all in activities that they used to enjoy. And that is also a major symptom or characteristic of depression, even in the absence of, quote, feeling depressed or sad. Additional contributing symptoms, both from a mood standpoint and physical standpoint, include feelings of hopelessness, feelings of helplessness, disturbances in sleep, which can mean either sleeping too much or too little, fatigue, weight loss, and loss of appetite. It also, as a phenomenon, depression can be episodic, so it can be just around the time of having a diagnosis of cancer, and that depression may not have existed prior to the diagnosis of cancer. It does not mean that it should not be treated. So major treatment strategies, the ideal approach is a combination of counseling and pharmacotherapy. And each of those approaches does provide some benefit on their own. Together, they provide even more benefit. In terms of the types of medications or pharmacotherapy, the first big class of medications used are the antidepressants, which I know sounds self-explanatory, but to say a little bit on those types of medications, they do take some time to take effect. They take up to 3 to 6 weeks, and sometimes that's a problem for patients. Patients who want to have more energy are really distressed by how they're feeling. But with regards to that, the two major groups of antidepressants that we see most frequently used are the SSRIs, which stands for selective serotonin reuptake inhibitors. Say that 4 times fast. And the SNRIs, which are both serotonin and norepinephrine reuptake inhibitors. So it involves just another additional neurotransmitter or chemical in the brain. So examples would include things like Paxil, the generic name is Paroxetine or Zoloft, Effexor or Cymbalta. And briefly about Cymbalta, this medication has in particular been highlighted as a drug that helps treat both depression and neuropathic pain. So it is a twofer. I think the one challenge is that it's quite expensive as one of the newest medications out there. It can be a couple $100 for a 30-day supply. The TCAs, or the tricyclic antidepressants, are a group of medications that are being used less and less, but I mention them because I think people still use them. There's definitely some synergistic benefit for both depression and neuropathic pain for that class of medications. In fact, Elavil has been a primary therapy for diabetic neuropathic pain or diabetic neuropathy. The other class of medications that are used for depression are the psychostimulants, and these are short-acting and really good for immediate effects. So patients who want to see some change in their mood, their energy quickly. And the first of these is Ritalin. It's the older one. It is more well known as a drug used for the treatment of attention deficit hyperactivity disorder in children. And the other one is Provigil or modafinil, which has originally been used for narcolepsy, but has also had good effect in the use of treating depression and then depression-related fatigue. Now, moving on to just a very recent topic that has come up with regards to depression and just distress in general. So multiple cancer organizations are starting to look at general distress screening tools to identify patients who are at risk and would benefit from additional support. So not specifically depression, but distress. Recent literature, and even as recent as literally this month, suggests that a new cancer diagnosis is a big, major life stressor and could increase the risk of suicide or even cardiovascular death. So I mentioned this recent New England Journal article because it just came out this month and really looked at a tremendous amount of data and a big number of patients, actually. So It looked at over 6 million Swedish patients, and of those, approximately 500,000 to 600,000 who had a diagnosis of cancer, and looked at the risk of suicide in the immediate period after a patient was given the diagnosis of cancer. And they did demonstrate an increase in the risk of suicide or cardiovascular death in the close time period after that diagnosis was given. I think one thing to recognize is that the numbers overall are, of course, quite small, but they were able to demonstrate that there was an increase in the risk, even if that risk is relatively small in both patients with cancer and patients without cancer. So the challenge with measuring distress and depression is that there's not a current standard approach or guidelines as to what to do if we measure this in patients and see these high levels as to what is going to provide good quality care for those patients and what interventions are then needed. So the last symptom I wanted to address was cancer-related fatigue. It is very common amongst patients who are undergoing chemotherapy and radiation, to 90% of these patients, but they're easily overlooked, and fatigue is often considered a, quote, expected symptom and dismissed, I think, because of that. This fatigue is specifically described as a very severe tiredness or decreased energy that's out of proportion to the activity you've had. So not the fatigue you experience after having a big half-marathon run, etc., but just after running an errand, etc. It does not respond to rest or sleep alone, and it often has multiple contributing factors. So the treatment approaches are somewhat complex. So initially, the approach is to treat any kind of contributing condition, anemia, depression, pain. Those are all major culprits that can contribute to this kind of cancer-related fatigue. Then you're looking at, if there's not a particular specific source, then there are some interventions, general interventions that can be used. So the first would be exercise. And actually there have been studies looking at aerobic exercise regimens for the improvement of fatigue and kind of energy, as well as physical therapy. And those types of interventions, I think, have a great role. They're not medications and can actually be very individualized for each patient based on what other symptoms or potential limits the patients may have and what they're interested in. Other interventions include strategies for just energy conservation, and that can be simple things like equipment to how you structure your day, as well as sleep hygiene. And while that's a bizarre term, it's really around how your routine is built for sleep. How do you ensure that you get good sleep that's uninterrupted, that's not fragmented? And then moving on to medications for cancer-related fatigue, the major class is actually that of the psychostimulants, which we see used for the fatigue and low energy that people see when they have depression. So they are used in this mode as well for cancer-related fatigue. Thank you very much for listening.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support. Thanks again.